The campaign season is here, and your vote can make a difference. Comcast brings you the candidates on demand right now.
I'm Jill Horner. This is Candidates on Demand. With me this hour is Gregory Pason, independent candidate for governor. Thanks so much for being with us.
Thank you.
You're running as the socialist candidate. Talk to us a little bit about your background and why you decided to run for governor at this point.
Well, I'm a community activist. I've been active in peace and justice coalitions. I'm a former co-president or co-chair of the National Writers Union in New Jersey. I'm also a dad. My son goes to high school, so I deal with high school issues and healthcare issues and family issues every day. And as a socialist, I'd like to see alternatives promoted, which are not being promoted by the major party candidates.
So let's focus on some of those alternatives as you see them. You have three major tenets to your campaign at this point. One of these is health care. This is something that under major discussion at the federal level, but what can happen here at the state level?
Well, I think we have to promote single-payer health care more. Our rolls of uninsured have decreased, which is a good thing, but that's only because we have a New Jersey family care plan. But that only goes so far. A single-payer federal system, if we push it enough with the president and have our representatives push it enough and pass a resolution in the state Senate and Assembly that we want it, would save the state $2.5 billion a year. That's enough to plug any deficit, cover our unfunded pension plans, and insure all the people in New Jersey more efficiently than the private insurance plan. I also oppose the privatization of Blue Cross and Blue Shield Horizon in New Jersey. We think healthcare should be nonprofit, not for-profit. And that's a bad move, privatizing a major insurer.
So when we talk about an issue like healthcare, what should be the government's role then? You're talking about a single-payer system, controversial at the federal level. Is it something that New Jersey could take up as some other states have?
Well, I don't think it's as controversial on the federal level with voting public. Anytime there's any sort of question put towards the public, we support a universal not-for-profit health insurance plan. When you get into the president's plan, then it gets complicated, and it seems like mandates and issues like death panels come up. That's where it gets complicated. If we say we wanted a Medicare system for all, people are supportive. They understand. And a single payer only affects the insurance companies. It's easier for the doctors. I think there was a survey recently, and it was 3/4 of physicians supported at least a public option. They would like to cut their costs by cutting the time they spend filling out forms for all these major insurance companies. You have one form like a Medicaid.
Okay, let's move over to some other issues. One of your big concerns has to do with making a living wage in New Jersey. We live in a very expensive state as compared to other states in the nation, and the way in which we're taxed in New Jersey.
Yeah, well, we don't like the regressive nature of our tax system. We rely on sales and property taxes, and that affects the poor residents the most. They're flat taxes, so we oppose it. We'd like to see a more progressive state income tax. We also have a minimum wage at $7.25 an hour. That's on par with the national minimum wage, and as you said, our cost of living is one of the highest in the country. To rent a 1 or 2 bedroom in apartment in New Jersey costs you from $10,000 to $13,000 a year. Yet your minimum wage would bring you home a gross income of $15,000 a year. That's just wrong. It doesn't make any sense. So we have to increase the minimum wage. We think we should be closer to $15 an hour. And for a business should be healthy business should be able to pay their employees enough to pay for an apartment. So we think that'd be more of a goal, $15 an hour.
What does that mean in terms of small businesses? Some have said we couldn't afford that much an hour.
Well, you're arguing with a socialist, so I'd say that that's a problem with the free market system. But I think, going back to our health care plan, if employees paid 4% Medicaid tax, instead of the employer, which our employer-based plan is paying for health insurance, I think that would really help small business. We've got to focus our energies on small business, not big corporations and businesses, so I agree. We can support. We also support worker cooperatives and collectives.
We just have a very short time left, but the third component of your plan really is to bring the National Guard home.
Yeah, it's been an ongoing battle. The National Guard was sent over based on legislation to take down Saddam Hussein. Well, Saddam Hussein is not there anymore, and now families are being broken up. Fathers are going overseas when they should be home helping with any sort of problem that happens here, not overseas.
All right, thanks so much. Good luck to you.
Thank you.
We've been talking with Gregory Pason, socialist candidate for governor of New Jersey. I'm Jill Horner.